There is a case of a 57-year-old female who had cervical cancer, and on scanning, this was the observation. In this tutorial, I am going to discuss on what is called hydronephrosis. What is hydronephrosis? The word itself, hydronephrosis, is a combination of two words, hydro from water and then nephrosis from the renal cells. The functional cells of the kidneys are called the nephrons. So when we have got water collection or urine retention in the kidneys, we call that hydronephrosis. Hydronephrosis has got a wider range of causes, be it the blockage in the kidney itself or blockage that can occur in the ureters, blockage that can occur at the bladder level, blockage that can occur at the urethra level. I'm not going to delve much into that, but I want to explain this particular case that I scanned at our radiology department. There is a case of a 57-year-old female who had cervical cancer, and on scanning, this was the observation. So you can actually see this is the left kidney. You can see these anechoic spaces or the black spaces that you are seeing here. This is an abnormal. We are not supposed to see fluid collection in the kidney as it were. But from this angle alone, it's very difficult for one to say with certainty that this is hydronephrosis, because there can be overlaps. Also, renal cyst or cyst in the kidney can mimic the same appearance. You can actually see the cyst in the kidney to qualify those as renal cyst. So what are we supposed to do? We are supposed to scan from various angles to check if there is communication within the spaces where fluid is actually collecting. So you see this, there can be an illusion here to say these are cysts, there's no communication, but let's do it this way. Looking at this, you can actually see now there is communication between the cystic spaces, communication. So when there is communication of this nature, we can say with certainty that this is hydronephrosis. So hydronephrosis, when there is no flattening of the calyces, as you are seeing, there's no flattening of the calyces, we can qualify this as moderate hydronephrosis. So when there is a blockage at the renal hilum or at the pelvis of the kidney, somewhere here, we just call that hydronephrosis. There are times during which blockage can be down in the ureter or in the ureters. So when there is blockage in the ureters, you can also see dilatation of the ureters. And when there is dilatation of the ureters, then we also call that hydroureteronephrosis, a combination of fluid collection in the kidney and the ureter is called hydroureteronephrosis. So you see the value of changing the angle of scan. So you can see from the previous video, we couldn't visualize that there is communication between the cystic spaces. So from this angle, you can nicely see that this is a case of hydronephrosis. Let's do it this way again. You can actually visualize nice communication within the cystic spaces. So there is a sparing of this cortex here. The cortex is spared here at this superior part, and then here there is degradation of the cortex, as you can see. So this is one of the major disadvantages of or the risks of hydronephrosis. At the time, it can actually cause renal failure. So the parenchyma or the functional part of the kidney dies with time. So patients with sustained hydronephrosis can actually develop renal failure with time. So hydronephrosis has to be managed before it complicates to hydronephrosis that can lead to renal failure, be it chronic or acute. So this is the right side of the kidney. As you can see, there is also collection of free fluid in the nephrons or in the calyceal space. So looking at this, these are renal pelvis, and at the renal pelvis you can see dilatation of the ureter as you go here, meaning to say there is blockage somewhere down here. So what you are seeing here, the combination of this fluid collection in the kidney and the ureter is now what we call hydroureteronephrosis. So playing this again slowly, you can see that's our kidney. The right kidney is a little bit different from the left because the parenchyma, much of the renal cortex is spared. So you can see there's a bigger cortical thickness here as compared to what we saw on the left side. So this is one of the signs or one of the complications of cervical cancer. It can actually lead to hydronephrosis as you are seeing. So this is cancer that is now spreading, so it's advanced cancer. So I'm not going to dwell much on the cervix. For now, I need you to appreciate what is called hydronephrosis. If it was severe hydronephrosis, we are not going to see part of these calyces. They're going to flatten out, and then you can see a single cyst occupying the whole region of the kidney and also communicating with the pelvis of the kidney, as it were. I thank you all for watching. I hope you're well. Remember to subscribe to our channel, share our channel. If you have got any questions, feel free our comment section and then type your question. We will respond quickly. Thank you so much.